Hi guys, how are you? I hope you are doing good. Welcome to another episode. Today we are going to talk about inflammation, mostly in relation to the body. Inflammation is the body's response to an irritant. So, an example of that would be a splinter in your finger, or if you're running and you sprained your knee, something acute that causes the body to flash, have severe pain. That's what inflammation is to the body. What happens to the body is it sends out its fast responders that are called cytokines. So wherever the injury is, if it's in your wrist, you're going to get the swelling, the flushed skin, warmth at this site, and the cytokines rush there to inform the body that something is going on. There are two types of inflammation: acute inflammation and chronic inflammation. Acute is an injury. You were running, you sprained your knee. That's an acute. You were working with wood or out in the garden and you get a splinter. That's an acute inflammation. Chronic inflammation is diabetes, arthritis, the pain that comes and goes. One day you have it, goes quiet, and then comes back. So pain that goes and comes. Arthritis is not constant pain. When you talk to them, sometimes they'll say when the weather changes, the pain is worse, and other times they will say that it's manageable. But change in weather does cause pain for most of the people that have arthritis. So those are the two inflammation: acute, splinter in your finger, you sprained your knee, you were running, and then chronic inflammation for people who have rheumatoid arthritis, to be specific, or diabetes. There are symptoms that present with both acute and chronic inflammation, such as flushed skin at the site of injury, pain or tenderness, swelling, and heat. Those you feel immediately. That's an acute inflammation. Chronic inflammation: abdominal pain, chest pain, joint pain, stiffness mainly. We go back to rheumatoid arthritis, they get stiff. Mouth sores such as HIV infection or skin rash. People who have psoriasis, they usually have rash to the elbows, any joints, but mostly to the elbow. You find they have a scaly, kind of white skin. That's their rash that shows up. What are the conditions associated with chronic inflammation? There are many of them, mainly asthma. They go through exacerbations. One time the asthma is not flaring up, and then another time there's an irritant if they sneeze into something and the asthma flares up. And then cancer, they go through pains, time where they have severe pain, and during remission where they don't feel the pain at all. So that's another kind of pain. Heart disease, rheumatoid arthritis. I repeat this because it's the most common disease that the inflammation is so severe, the pain becomes so severe during changes in weather. And then type 2 diabetes is another one that is associated with chronic inflammation. What are the most common causes of inflammation? Most people who have inflammation, autoimmune disorders such as lupus, where your body attacks the healthy tissue. That's one of them. Exposure to toxins like pollution or industrial chemicals that can cause inflammation. Untreated acute inflammation, such as an infection or an injury that wasn't treated, that causes inflammation. Some lifestyles will make us have or cause inflammation to the body, such as drinking alcohol in excess, weight gain. A lot of weight gain causes inflammation in the case of joint pains. The joints are carrying a heavy weight, so then over time it affects the joints and you get joint pains for that. So obesity is one of them. Exercising, maximum or high intensity exercising, to some people it works well for them because they can get through the workout quickly, but some people it causes pain. Or if you don't exercise enough, then you go and exercise, that can cause pain too. Other causes of inflammation: chronic stress. Chronic stress to the body will come out as inflammation. Some people have trigger points in the shoulders, or they tell you, I carry my stress in my shoulders, or I carry my stress in the neck. That is how it manifests itself. Smoking over time, especially in the feet, you don't notice it then, but chronically over time, you're going to get pain in your feet from smoking. There's a disease that's attached to that. Is called peripheral artery disease, where it affects the feet. How is inflammation treated? Some people take vitamins and that helps them. Some people exercise. That's another good way of treating your inflammation. Taking your supplements, your vitamins, zinc, vitamin D, vitamin C. This reduce inflammation and enhance repair of the body. So it's important that you take your vitamins. Another way you can reduce it is non-steroidal anti-inflammatories. These are common. They are over the counter. An example is such as Advil, ibuprofen, naproxen. Amazing over the counter drugs, but they can be hard on the stomach. So if you do take them for inflammation, take them with food. So it's important that you take them with food, because over time they do cause reflux symptoms or discomfort in the abdomen. So that's another way you can treat the inflammation. Acute inflammation, you can use ice. Ice is a good anti-inflammatory. You put ice to the affected area. It reduces the pain, reduces the inflammation, and reduces the swelling. It's uncomfortable at the time that you put it, but once you take it off, you're going to feel the relief of it. Another medication that helps with reduction is steroid injections. Injections to the affected areas. These are mostly, people get them in the shoulder joints. Other people also get them in the knee joints. Wherever the pain is, they can give you the steroid injection there. But most common cause of steroid injections is they'll give it in the shoulder or the knee. So some people who have that severe pain where the walking is just uncomfortable. I can't move my shoulder. My shoulder pain has become so bad. Your doctor may decide to give you a steroid injection. Granted, it's sometimes they give it to you, you have relief for a little bit, and then after a while you don't have any relief of the pain, or sometimes they give it to you and 6 weeks or 8 weeks you are pain free. So that's another way of treatment of inflammation. What do I do for home inflammation remedies? Some people may ask. Change your diet. There is an anti-inflammatory diet that some people follow. Reduction of oily foods, reduction of starches, fried foods. Reduce your fried foods. Some people don't take cured meats. Avoid highly refined oils and fats. Olive oil, oily fish, salmon, sardines. That is part of the anti-inflammatory diet. So that helps. So that's a way that you can do it. Exercise, gentle exercise, that's good for the body. Like if you have joint pain, swimming, gentle walking, that helps reduce the inflammation too. Now, if your joints are aching and you're in a high intensity training class, that's, in that case, it's worsening the pain other than improving the pain. So it's important to find what your body can handle at the time of your injury or inflammation in this case. If it's severe pain, you have no business going into a high intensity training class. When you go to that, you'd rather put ice on the affected area, rest it, ice it. If it's swollen, compression, and that's going to help with the inflammation or reduction of inflammation. And the medications too, but be careful with the medications. Look at the directions. Don't take them on an empty stomach. Never take steroids on an not steroids, non-steroidal anti-inflammatories on an empty stomach. Eventually they cause stomach upset, so don't do that. Another thing, refined carbohydrates. Reduce refined carbohydrates. Those can cause inflammation. How can I prevent inflammation, you may ask? Achieving and maintaining a healthy weight, because then you don't have the excess body weight to cause stress to the joints. That's one way you can do it. Avoiding or quitting smoking. That's another way you can do it. Exercise 3 to 5 times a week. Limiting alcohol intake. That's another way. And then managing stress. Managing stress is important because for most people, stress comes out as pain in the body. When you have this chronic inflammation and you don't know what's going on, it's a good way to look at how you handle stress, because that will come in as inflammation. So take care of yourself, take deep breaths, walk outside. There's something unique about walking outside in the sun. It's good for you. Vitamin D, if it's before 10 or after 4 p.m., because during summer, 10 to 4 p.m. is too much sun for your body. So before 10 p.m., after 4 p.m., that's good for you. There's something about the trees. There's something about nature. So go out there, enjoy the weather, and don't forget to sleep. That also reduces inflammation. So those are the main keys that I can think about for basic inflammation. Basic inflammation. I only broke it down to acute inflammation and chronic inflammation. You guys have a great week. Hope to see you in the next video. Bye-bye.